Today's presentation is brought to you by Safe Kids Lincoln Lancaster County and the Sports Injury Prevention Task Force. It is titled Preventing Concussions, Dehydration, and Overuse Injuries in Youth Sports.
Concussion is the first topic we're going to discuss. So a concussion is a complex process affecting the brain that is generally induced by a traumatic biomechanical force. This force is going to be something like a blow to the head or to the body that would cause the brain to move around inside the skull. When the brain moves inside the skull, it bounces around off of the inside, which basically causes a bruise on the surface of the brain. It is important to note, though, that this bruise is more reflective of a functional disturbance, not a structural injury. So if you send a kid to the ER suspecting a concussion, they're probably going to scan them and send them back saying that everything's fine because a concussion does not show up on the scans that they do at the ER. It may or may not result in a loss of consciousness, and it's also important to note that young athletes are 3 times more likely to sustain a concussion than collegiate or professional athletes, so in this age group you're probably going to see concussions. There's a whole list of signs and symptoms of concussions that are up here. Some of the more common ones that you are probably going to see, especially right away, are going to be confusion or disorientation, headache, sometimes nausea, balance problems. Just in general, they're just going to say that they don't feel right. It's important also to note that these symptoms can come anywhere from right away after this happens up to even a few days later, so it's important to monitor these kids for a while after you suspect something has happened. Coaches have a very important role when it comes to concussions because coaches are the ones who are on the front lines. You guys are the ones that's going to see something happen. You guys are the ones that are with these kids at practices and at games day in and day out. So make sure you pay attention to that. Just recognize that the potential is there. And then the biggest thing is if there's any question that something may have happened, always pull them out of competition. When in doubt, sit them out. You're also going to want to refer them to one of these appropriate medical professionals that's listed here. And just remember that they cannot return until they are no longer experiencing any signs or symptoms and they've been cleared by one of these medical professionals.
So the next important topic is dehydration, and you can see that several different things will cause a person to become dehydrated. One of the ones here that we want to just briefly talk about is vomiting and diarrhea, because that will make someone dehydrated even if they're not involved in a sport. So then if they are then outside and doing activities, or even inside and doing activities and sweating and that, they're already going to be dehydrated because of this. So these are all just different ways that someone will get dehydrated, and we want to take extra care with someone that has been sick for those reasons just stated. You can see that this does start somewhat mild, but it also can be severely life-threatening and definitely can affect someone's mental status where they become delusional, and then, of course, can affect their physical performance as well. One last thing to point out is dehydration most often occurs outside of exercise in the heat, but like mentioned, it could happen inside as well. If someone has a lot of clothing on or something like that, they could get overheated in that, which will cause them to get dehydrated as well. So we need to be on watch for that. And you can see some of the things that are listed here in this chart. So when we're talking about dehydration, heat illness is very important to talk about with it. And the first heat illness that we'll talk about is heat cramps. You can see from this picture, the most common one is in your calf. Many of you might have experienced this before. You can see, though, that it can happen in other parts of the body. The biggest thing that this is caused by is loss of fluids and loss of electrolytes. So we definitely want to stop them from the activity when this happens. We want to cool them, but we really need them to get fluids so they get this water back in them. They get electrolyte drinks like a sports drink back in them. And the other thing we want to do, like for example for this calf, have them straighten their leg and then just gently push back on their foot so it's going towards their shin. That'll stretch that calf out and will help that relieve that cramp. You can also use ice around that cramping area, and that will help relieve it too. They potentially could go back with a cramp, but you do need to keep an eye on them for the other heat illnesses that we'll talk about now.
So heat illnesses are generally speaking a spectrum, so it'll start at cramps, and if you don't stop it, it's going to progress to these next two, which are more severe. So that's why it's important to always pay attention and make sure you stop it when it still is at that cramp stage if you can. The second stage is going to be heat exhaustion. You're going to have the kid looking pale and ashen. They're going to be sweating very heavily. Their heart will be beating very fast. They're going to be tired. They might be feeling sick, and they're probably going to have a headache. It's very important that you remove them from activity into a cool place, whether that's inside or if you're at a big facility that's pretty much all outside. Put them in a car with the air conditioner running. Loosen or remove any wet clothing or tight clothing, because anything like that can trap the heat to your skin and to your body. Cool them off in any way that you can possibly think of, whether that's fanning, spraying them with water, putting cold water around their neck, cold towels around their neck. Give them something to drink especially, and be sure to watch for worsening conditions, because it'll rapidly progress to this, which is heat stroke. This is a medical emergency. You need to call 911 right away if you see something like this pop up. They're going to have flushed hot skin, no longer sweating. They'll have decreased heart rate and blood pressure, increased respiration, faint and dizzy. They'll be confused and combative. They will probably be unconscious, and they'll definitely have an increased core body temperature. So again, remove them from activity, call 911. This is a medical emergency. It actually, though, is important to try and immerse them prior to transporting them to the hospital. This is one of the only times when you're going to be doing your athlete a disservice if you send them right away, because they need to get cooled back down, and they're not going to be able to do that adequately in an ambulance. The best way to do that is by cold water immersion. So put the athlete inside a tank with cold ice water in there to help cool their body temperature quickly.
Obviously, one of the concerns of this task force is to prevent injury. So we talked about concussions. Let's talk about preventing heat illness. So we want to acclimate the students days prior to competition. So that means we just don't want to go out that day and not having practice at all, not having ran activities at all, and then also not just not doing it at all, but not doing it in similar circumstances. So we want to acclimate them. We want to make sure that the student athletes are hydrating before, during, and after activity, and really water is the best. You could use sports drinks before and after, but really water is the best, especially during. Unless it's a long day and long activities, then you definitely want to replenish with electrolytes too. When it's super hot, we need to change and not have our activities at those parts of the day. If we do end up having them at those parts of the day, then what we need to do is we need to shorten the activity time. We need to lessen the intensity. We need to change what types of clothing. So if it's with equipment, maybe less equipment. We want to make sure we take frequent breaks when it's in those types of circumstances. The other thing is that when they are taking breaks, get them in the shade, spray them down, cool them off, give them things to drink. And when they are wearing clothing, the best thing to do is light clothing, lightweight clothing, bright clothing that will reflect the sun's rays, things that will keep them cool. And then we definitely want to monitor those. We talked about earlier about someone that might have had diarrhea and vomiting, those types of things. Monitor them. Make sure that they're doing okay. Monitor not just our student athletes, but our coaches, our fans, anyone that's out in that area. We need to be keeping a watchful eye, especially the really young and the really old, because they have a harder time regulating their body temperature. You can see the different list here of those that can be at risk, so we want to look out for that. And one of the easiest ways to tell if someone is dehydrated is actually if you're thirsty. If you're thirsty, you want to drink, so drink to thirst. But also, you can see the color of your urine can help you with that as well. But one little tip, though, if someone does have a problem, some type of medical problem, or taking medication that makes their urine dark, they need to know what is dark for them and what is really dark for them then because of that.
So one of the most common types of injuries that you're going to see in this age group is an overuse injury. So an overuse injury is an injury that just comes from the repetitive act of playing the same sport over and over and over again. The most common ones you're going to see in this age group are to the knee or to the elbow or shoulder in like a baseball pitcher. The best way that we can prevent these overuse injuries are to make sure you have the athletes report any pain, injury, or illness right away. We don't want to wait and let it get really bad, because then it's hard to get rid of them. Make sure you use ice to help reduce pain and swelling almost every time you actually are active. Refer to a physician if the pain does not go away in a few days. Again, early recognition is important on these. They're also going to commonly pop up in the middle to late time of the season, so be especially aware during those times.
And one of the key things in preventing overuse injuries is to not specialize in one sport before the age 15 at the earliest. Encourage your kids to be multi-sport athletes, and that actually, by doing another sport, actually counts. You see down below where it talks about a rest of 10 consecutive weeks. Being in another sport actually is rest from one sport because you're using different muscles and it's a totally different activity. But you can see that they do need some days off during the week, and they should always start with a warm-up and stretching. We want to thank you for watching this presentation today from Safe Kids Lincoln, Lancaster County. And for more information, go to the website that's listed here. Again, thank you and good luck this season.